Thank you so much, Vanilla, for your truly beautiful and soul-stirring performance. It's a rare gift to have soothing voice with elegance and unforgettable performance. I want to say a शेर मेहनत की राहों पे चलना पड़ेगा मेहनत की राहों पे चलना पड़ेगा रातों को जागना सुबह संभलना पड़ेगा किताबों से दोस्ती जो कर लोगे तुम किताबों से दोस्ती जो कर लोगे तुम दुनिया का हर मुश्किल सफर आसान लगेगा
वाह 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 वाह. Till now, we got psychiatrist perspective. Now it's time to have a physician's perspective.
When diet is wrong, medicine is of no use. When diet is wrong, medicine is of no use. When diet is correct, medicine is of no need. Krishna, you're saying about physician. Are you thinking to address him? I'm so excited.
Yes, Munazza, your excitement is on point. He is none other than our honorable principal, Professor Dr. Ravindra Kumar Sudarshi, sir. Belongs to Department of General Medicine, GMC Medak. His alma mater is Guntur Medical College. Worked as Assistant Professor of Medicine in Usmania Medical College in 2011 and HOD of Medicine in Gandhi Medical College in 2023. And because of his dedicated work, now he is working as principal of GMC Medak. Welcome.
Ladies and gentlemen, it is an absolute honor to welcome to the stage such an inspiring individual who has dedicated his life to serve the service of others. A compassionate physician, Dr. Ravindra Kumar sir, whose expertise, commitment, and care have touched countless lives. Not only he is the pillar in the medical community, but also a remarkable human being whose work continues to inspire and heal. Please join me in giving a warm and respectful welcome to Dr. Ravindra Kumar, sir.
Thank you. Thank you. Madam, please, please. Thank you, madam. Thank you. Thank you all. Good afternoon, all. Now, I am going to discuss on management of gut-brain axis disorders. Management of gut-brain axis disorders. So, by definition, gut-brain axis refers to bidirectional communication network linking GI tract and brain. It involves a neuronal, immune, endocrine communication pathway between gastrointestinal tract and central nervous system. Vagus nerves transmit crucial information from the viscera, that is gastrointestinal tract, cardiovascular system, respiratory system to CNS. This diagram represents the bidirectional way of communication between the gut and the second thing is in the gut brain axis, dysbiosis. What is dysbiosis? Imbalance in the gut microbiota is due to decrease in microbiota richness, loss of beneficiary flora in the gut, or loss of increased pathological bacteria in the gut. So this leads to metabolic disorders, systemic inflammation, endogenous intoxication, reduced essential metabolites. This diagram shows homeostasis is maintained in diversity if microorganisms are both existing properly, diversity is maintained. If there is any decrease in the beneficial microbiota or increase in the pathogenic microbiota, reduce the diversity. that causing dysbiosis. So these are various conditions that not associated with the gut. These are autism, anxiety, obesity, Parkinson's disease, ulcerative colitis, depression, liver enzymes, and heart disease, rheumatoid arthritis. So many diseases are there. So main causes of dysbiosis. Main causes of dysbiosis by diet, essentially diet. What are the diet that causing dysbiosis? High rich sugars that contain food, or food stored chemicals that associated with food, that is chips and westernized foods, and the high fat diet. These are all causes dysbiosis. Increased alcohol consumption, drugs, antibiotics, chronic use of antacids, sleep deprivation, stress, infection, all these factors cause dysbiosis. Certain microbiota in gut are capable of producing some enzymes, metabolites, which facilitates synthesis of neurotransmitters. These neurotransmitters are excitatory neurotransmitters and inhibitory neurotransmitters. Excitatory neurotransmitters are glutamate, acetylcholine, norepinephrine, and dopamine. Inhibitory neurotransmitters are GABA, glycine, serotonin. They mediated intercellular signal transduction, neuronal signaling, influencing learning, emotion, and memory. So this disruption of these enzymes leads to diseases like irritable bowel syndrome, inflammatory bowel disease, neurological degenerative disorders, autism spectrum disorders, Parkinson's disease, Alzheimer's disease, MND, motor neuron disease, depression and anxiety, and anorexia. So now we are discussing about some diseases. Irritable bowel disease. It is characterized by abdominal pain, abnormal defecation in the absence of structural abnormalities. Altered 5-hydroxytryptamine signaling in CNS and GAT is implicated in IBS. Same evidence is considered it as a serotonergic disorder. Excessive release of 5-hydroxytryptamine associated with diarrhea predominant IBS. Deficiency of 5-hydroxytryptamine associated with constipation predominant IBS. In this case, 5-hydroxytryptamine agonists are useful in treating constipation predominant IBS. 5-hydroxytryptamine antagonists are useful in treating diarrhea predominant IBS. So there are so many factors are associated with IBS. So some are luminal factors, alteration in the intestinal bacteria, small intestinal bacterial overgrowth, gut dysbiosis. These are all explained in IBS. And diet associated with the lactose, fructose, sorbitol, collectively known as FODMAP diet. This FODMAP diet fermentation in the colon leads to bloating pain, wind, and altered bowel habits. Clinically, how to diagnose irritable bowel syndrome is clinically, if the patient came to you with continuous 3 days of abnormal pain or discomfort in the abdomen for last 3 months with altered defecation or change in frequency of stools, change in appearance of stools, we should diagnose it as a irritable bowel syndrome. It is a clinical diagnosis. Main treatment is diet. Fiber-rich diet is avoiding diarrhea-induced IBS. Fiber-rich diet is advised in constipation predominant IBS. Gluten-free diet is avoided in diarrhea-induced IBS. Low FODMAP diet, probiotics are useful. If they are not responding to above treatment, antidepressants are useful in this type of IBS. And IBS associated with constipation, predominant IBS, high fiber diet is advised, lactulose, procalpride, psychotherapy, diarrhea predominant, IBS associated with pain, diet control, low FODMAP diet, antidiarrheals like loperamide, mebaverin and hyoscine for pain, probiotics and or rifaximin are useful in diarrhea-induced IBS. If they are not responding to our treatment, antidepressants are next line of treatment. Next disease is Alzheimer's disease. Alzheimer's disease is a neurodegenerative disorder condition characterized by progressive loss of cognitive function, primarily affecting the memory. So genetic factors play important role in Alzheimer's disease. Early onset of Alzheimer's disease associated with autosomal dominant inheritance. Late onset is polygenic. In Alzheimer's disease, many neurotransmitter abnormalities have been described. There is a impairment of cholinergic transmission abnormality, noradrenaline, 5-hydroxytryptamine, glutamate, and substance P in the neurons is observed in Alzheimer's disease. Dadiot et al. Postulated increase in pro-inflammatory bacteria such as bacteroids in the gut observed in Alzheimer's disease. They increase in gut permeability, cause systemic inflammation and central inflammation also observed in Alzheimer's disease. Next one is Parkinson's disease. This is a movement disorder characterized by tremor, rigidity, and bradykinesia and akinesia. The most consistent pathological finding in Parkinson's disease is degenerative nigrostriatal tract. Depletion of dopaminergic neurons in substantia nigra results in reduction of striatal dopamine, which is main biochemical abnormality in Parkinson's disease. Normally, equilibrium exists between acetylcholine and dopamine. Dopamine deficiency leads to acetylcholine hyperactivity. This leads to tremor and rigidity, and all the symptoms are exist. Several studies have been identified an overrepresentation of Helicobacter genus, Helicobacter pylori, in individuals with Parkinson's disease. Thus, bacteria have been associated with increased neuroinflammation process in Parkinson's disease. MPTP is an environmental toxin that leads to Parkinson's disease, also explained in some studies. Next degenerative disease is motor neuron disease. It is a neurodegenerative disorder affecting both upper motor neurons and lower motor neurons, characterized by weakness of limbs, wasting, and spasticity. Some clinical trials showing that fecal biometa transplantation with probiotics improves disease progression and clinical symptoms in motor neuron disease. The autism spectrum disease also sir explained. Some prebiotics and probiotic treatment are useful in clinical trials showing that prebiotics and probiotics improve the symptomatically in autism spectrum disease. So next one is therapeutic approach. What are the therapeutic approach? Main therapeutic approach in this gut-brain axis is diet. Diet rich in fruits, vegetables, legumes, cereals. But the Mediterranean diet is increase the gut eubiosis. Avoidance of high sugars, high fat diet, alcohol. These are all causing dysbiosis. So in this slide showing bacteria, these showing bacteria and lactobacillus, which are decreased in gut, causing gut dysbiosis, leads to cognitive decline and mental disorders. Gut eubiosis by means of probiotics and exercise leads to neuronal plasticity, cell vitality, normal cognitive function. So therapeutics are prebiotics. Prebiotics are indigestible dietary compounds. These are food to gut bacteria, altering their composition and activity. they reduce the intestinal pH. So they provide favorable environment for beneficial bacteria such as lactobacillus, bifidobacteria, inhibiting pathogenic bacteria. Next one is probiotics. Probiotics are live non-pathogenic microorganisms. Example, bifidobacterium, bacillus, streptococcus, enterococcus. They regulate gut microbial population, reduce pathogenic colonization, increase epithelial cell proliferation and differentiation. They reduce the immunomodulation. They produce beneficial chemicals like small chain fatty acids. These are some of the examples of probiotics and food, probiotic food and prebiotic food. The probiotic foods are mostly fermented food. Curd is one of the probiotic food, and these prebiotics are flax seeds, chia seeds, beans, peas, banana, um, berries, garlic, asparagus. Symbiotic. Symbiotic is a combination of prebiotic and postbiotic. It is a specialized formulation of prebiotic and probiotics more effectively compared to separate administration of pre and probiotics. A novel symbiotic comprising of prebiotic palmitoyluric acid and probiotic lactic acid bacillus, Rhamnus GG, promoted their respective neuroprotective against Parkinson's disease. These are some of the functions of symbiotics. Symbiotics, they prevent diarrhea, constipation, improve skin condition, improve digestion, prevention of seasonal infectious disease, improve the absorption of vitamins and trace elements, normalize intestinal microflora, destroy pathogenic organisms, strengthen the immunity. These are all the functions of symbiotic. Another treatment is fecal microbiota transplantation. Fecal microbiota transplantation is used in some degenerative neurological conditions. It aims to restore healthy gut microbiome. The availability of well-organized stool banks are available in some centers. They are administered via enema, capsules, colonoscopy. These are route of administration. So fecal microbiota transplantation as a potentially convenient and effective therapy for the treatment of neurodegenerative diseases. This slide showing how to prepare fecal microbiota transplantation. Healthy donor collect a stool from the healthy donor, conducting laboratory tests to detect potential pathogens, preparing a fecal sample in safe way according to the well-established protocol. This fecal microbiota administered in the form of gastroscopy or oral capsule or via colonoscopy. These are some of the formulas available in the market. This is one of the investigation to evaluate the degree of gut biases. This is called gut microbiome metagenomic. It is available in some centers in Hyderabad. So it is a upcoming interesting topic. There is we should all involve further research in this area. Thank you.
Thank you so much, sir.
Now, we would like to open the floor for some questions. If anyone has any queries or thoughts, please feel free to raise your hand and ask questions.
Our honorable speaker, Dr. Ravindra Kumar sir, will be happy to engage with you and provide further insights. Let's make this session an interactive and enriching session. Please, any questions?
Sir, I have a question, sir. Uh, Sir, fecal biometa, microbiometa transmission is there, sir. Is it more essential through oral route, sir?
Through oral route, they give by capsules.
Efficacy is good, sir. Through oral route capsules, is it efficacious, sir? Yes.
That,
Okay.
these are all clinical trials.
It's still clinical.
Especially these are clinical trials. The route of administration through this thing, the clinical trials showing some benefits. There is no definitive evidence
Yes, sir.
showing slowness of the disease is there, but there is no definite cure like that.
Okay.
This shows some improvement the clinical symptoms, and there.
This is
This is research.
okay, sir. Thank you, sir.
So thank you for the presentation. Just one question regarding Parkinson's disease. Is it like have you gone through any studies which show that if you give it before people develop Parkinson's, or should we give it when people develop Parkinson's? You come across any such data, sir?
Parkinson.
Parkinson's, sir.
Regarding the Parkinson's disease, also they are doing for late stages. Late stages they are doing. Initial stages they are not doing. Late stages in some centers under the guidance of neurologists they are practicing, especially in AAG they are practicing. Thank you. Thank you.
Sir, you have given a wonderful presentation regarding the dysbiosis of gut-brain axis. Sir, as Dr. Rajshekar sir asked, in autism also, there is a lot of research going on. So there are many online people also who were asking about the treatment for autism. So can we do research into this subject wherein we can start early about from 3 years, as sir was saying, till 6 years, we don't give any treatment, interventional treatment. Can we start early, like first year? Like if you take our phenylketonuria, we catch them early to prevent the lowering of their intelligence quotient. Like that for autism, can we start the treatment early with fecal biomata?
Good question, madam. But
Sir.
all these are clinical trials only. Clinical trials. We have to apply and we have to see what are the improvements or other symptoms. And there is no definite improvement like that.
Correct,
So
sir.
with what age we have to start, we don't know. But gut microbial dysfunction is morely after adult age. That is described.
Okay, okay, sir.
Gut dysbiosis is mostly after adult age only, not in
Okay.
the children. That
Okay.
is described in textbooks.
Yes, sir. Yes, sir.
That's why it's better to start late.
True, sir. Thank you, sir. Thank you.
Do my online audience have any questions? Okay. On behalf of everyone here, I would like to extend our heartfelt thanks to you, sir. Thank you so much for your incredible, insightful words, which have truly enlightened us with deep understanding of the topic. Your contribution has certainly left a lasting impact, and we feel privileged to have had the opportunity to listen you. Thank you so much, sir.
We are truly grateful for the time and effort you have put in sharing your thoughts with us today, sir. Now we welcome Professor Dr. Shanta Kumari ma'am, organizing chairperson, and Dr. Suman sir, organizing secretary of CPT program, for felicitation of our chief guest speaker, Dr. Ravindra Kumar sir.
Give him a big round of applause.
Gunaza, after all these amazing study sessions, let's have some refreshing and relaxing session.
Hey everyone, keeping your body healthy is an